Hi there, my name's John Mabey, and welcome to Hippo Shorts. In this segment, we're going to talk about acromioclavicular joint injury versus shoulder dislocation. So let's define these. The acromioclavicular joint, better known as AC joint, injuries involve a tearing of the acromioclavicular ligament and possibly the coracoclavicular ligament. Consequently, injuries range from a mild sprain all the way to complete disruption of that AC joint. The mechanism of injury usually involves like a direct blow, for example, falling directly onto your shoulder with an adducted arm. So that might be like in this position, you're playing football or something, and whack, you fall directly on your shoulder. So that's the common mechanism for that. Shoulder dislocation, on the other hand, is the separation of the glenohumeral joint and involves tearing of the ligaments that hold the humeral head within the glenoid fossa. It's also not uncommon to have associated rotator cuff muscle or even tendon injuries as well. The mechanism for this is different. This usually involves a foosh, right, fall on outstretched hand injury, and the arm typically is abducted and externally rotated. So you kind of have like a mechanism of like that. And you can imagine if your arm goes that way, your humeral head goes this way. So the most common shoulder dislocation then is anterior. Let's take a look at this slide. So some of the key physical exam findings are, with the AC joint tear, we're going to see swelling and tenderness over that acromioclavicular joint, right where that finger is on that person's shoulder. There's going to be a decrease in range of motion of the shoulder. And if you have complete diastasis or complete tearing of those ligamentous structures, we can have a prominent clavicle visible on physical exam as well. Shoulder dislocation, on the other hand, is shown in the photo on the right. Here we have loss of the deltoid contour. So that's classic. In fact, that's referred to as a squared off shoulder. The other thing that you want to be aware of with shoulder dislocations is there's a higher incidence of damage or injury to the axillary nerve. So you want to make sure that you examine that appropriately as well. On this next slide, let's take a look at the classic X-ray findings. The image on your left shows you that AC joint tear. This is a type 3 tear where we have a complete separation of that distal end of the clavicle from the acromion. And you can see that clavicle is just riding up much, much higher than it's supposed to be. The image on the right-hand side shows you a shoulder dislocation where that humeral head is not where it's supposed to be. It's supposed to be in that glenoid fossa. So that is radiographic evidence of a shoulder dislocation. That wraps it up for this segment. For more information on this or other topics, come on down to hippoeducation.com. We'll see you next time.